Hi everyone, this is Dr. Chloe here at Integrated Health Solutions in Indianapolis, and today I want to talk about how some people might be dealing with some lateral knee pain. That's this part of your knee right here, and how it is a really common issue. Today I want to dive into how the hips and the feet might be playing a role in your knee discomfort, so let's take a look. When we experience knee pain, especially on the outer part of our knee right here, the assumption usually is that the pain's coming from the knee itself, but in reality it might be coming from a little bit higher or lower up in our kinetic chain, so that might be the hips or the feet. So let's look at how those specifically could play a role. The body works as a system where everything is connected. If one area isn't moving properly, it can cause a compensation in another. For example, if your hips are tight or not moving as they should, they can throw off your entire alignment, putting extra stress on your knees. Similarly, if the problem is in your feet, like poor arch support or limited mobility, that can impact how your knees move during everyday activities, which can lead to pain and discomfort. Let's take a look at the hip. So the hip joint is responsible for a lot of our lower leg movement. Now, when we have tight muscles in the hip flexors or the glutes, that can cause the way that we move our knee significantly. So, an example, if we have tight hips or tight glutes, that can cause a condition called knee valgus, which the knees come in forward. Now, with this, when we're doing things like running, jumping, lunging, and our knees are moving inwards, this is going to put a lot of extra strain on that outer part of the knee, which can contribute to a lot of the pain and discomfort that we're feeling. A few simple fixes for tight hips would be strengthening and mobility exercises. So doing things like specific hip flexor exercises, 90-90s to improve that hip mobility will be really helpful. Making sure that you really focus on form so that way we don't create any future problems. Now let's talk about the feet. The feet are the foundation of all our movements through the body, and having uneven discomforts and pressure through those feet due to lack of mobility can really contribute to the knee and other parts of the body. So for example, if we have limited dorsiflexion, which is pointing our toes up towards the sky, this can put an unnatural rotation into our knee, putting more stress especially onto that lateral aspect. To improve foot mobility, I will focus on things like strengthening and mobility of the foot itself. So trying things like ankle alphabets to gain that mobility, and working on toe mobility, strengthening, and balance to really improve the way that our foot is contacting the ground and implementing that force up through our body. So if you're dealing with lateral knee pain, don't just look at the knee itself. Try some exercises in strengthening for the hip and the feet to help make sure that our entire kinetic chain is moving in one function. If you're not sure where your pain's coming from, feel free to come on into the office and have one of our chiropractors evaluate you to see how we can improve your mobility and your function moving forward.